It's been an exhausting 2 weeks. Yeah, it's been very tough. There have been good moments. And there have been frustrating moments, but at the end of the day, if we all do this little bit once at a time, sharing of knowledge and medication will make an impact.
Katika kulinda mila zetu na desturi, katika kulinda mila zetu na desturi, sana na utamaduni tujivunia, sana na utamaduni tujivunia, katika kulinda mila zetu na desturi, katika kulinda mila zetu na desturi. Haya jamaa wakelewe tuzidumishe, haya jamaa wakelewe tuzidumishe, Tanzania tuzidumishe, haya jamaa wa Tanzania tuzidumishe, tuwadifishe watoto wetu maadili mema, tuwadifishe watoto wetu maadili mema, sana na utamaduni tujivunia, sana na utamaduni tujivunia, katika kulinda mila zetu na desturi, katika kulinda mila zetu na desturi.
CACHA is Canada Africa Community Health Alliance. It's a group of Canadian physicians and nurses that got together with a vision to go where medical care is extremely difficult to get, and in an area where it's impoverished and the locals cannot either access medicine or cannot afford to access medicine.
Kwanza tumelichukua vizuri kwa sababu limesaidia kupanua wigo wa huduma kwa jamii ambao sana sana hana uwezo wa kuchangia zile gharama za matibabu, hasa wale katika maeneo ya vijijini ambapo kuna usafiri au miundombinu ambayo sio mizuri zaidi.
So CACHA was created with a view to go to areas where there aren't any foreigners present. Ukerewe happened to be one of those areas, and we got a few of the physicians and nurses together. We spent about 2 weeks, and we basically have had great help from the bishop organizing at the local level in various communities, in various villages, where we go once a day in caravans. So basically we start early in the morning, we haul our medications in the caravans, and we go to a village. is organized. The clinics are organized either in a school or a church or whatever space that we have. And we see anywhere between 350 and 450 patients a day. We're organized where the medicine people are hooked up with local medical personnel. So not only are we providing medical care for the locals and the medications as well, but it also gives us an opportunity to transfer medical knowledge to the locals so they can continue providing those care while we're gone. So each medical doctor or a nurse from Canada gets hooked up to the local medical officer, and they together see patients with us. So we spend the entire day seeing those 400 odd patients. And so they get an idea as to what we are thinking about, what our thought patterns are. They ask questions, we ask questions. We make sure that we are able to transfer the thought processes behind making diagnoses. Although the clinical officers also in return are very helpful because they understand local disease patterns better than we do. So it's a giving and taking of information. And hopefully that makes us all better providers of healthcare. Some days you feel that you've done something, you've helped somebody. Some days you feel utterly frustrated because you know what's wrong, but you cannot provide the care because it requires specialized care, or requires certain types of medications, or it requires further investigations before coming up to a final diagnosis.
Yaani wameniambia wamempa dawa tumie, tutarudi tarehe 15 wamsafirisha wampeleke India mwezi wa 5 tarehe 15.
Surgery. Nataka surgery kubwa. That's where it gets very frustrating because while you know what you need to do, you cannot do it. A, because you don't have the equipment for further diagnosis, or B, because you don't have the high-tech medications required to treat such cases.